Today we are witnessing again a case that challenges our basic understanding about the fundamental right to health, the control of our body, and the right to make decisions what is best for our children. The parents of a 5-year-old cancer child in Great Britain were dissatisfied with the conventional treatment of the brain tumor of their child with chemotherapy and radiation. In their despair, they took their child and traveled to Spain. But this was only the beginning of what would be a long journey. The hospital in the UK reported the interruption of the chemotherapy cycle to the police, whereupon an international arrest warrant was issued for the parents who were accused of child abduction. This arrest warrant led to the apprehension and incarceration of the parents in Spain. With the parents in jail, the child was brought to a hospital in Malaga, waiting now for the continuation of chemotherapy. The latest news is that the parents have been released from prison and were allowed to visit their son at the hospital. This event, which is taking place at the beginning of the 21st century, in countries that pride themselves of being civilized, reminds me on a similar tragedy that took place 10 years ago with 9-year-old Dominic, a child that had developed bone cancer. In the belief of saving his life, his parents had brought Dominic to a chemotherapy center at the University of Münster in Germany. After a few months of chemotherapy cycles, Dominic weighed only 40 kilograms and was about to die. In this situation, the parents took him home and began a regimen of healthy nutrition and nutritional supplements specifically developed to block cancer cells in the body. Under this regimen, the previously diagnosed metastasis in Dominic's lung disappeared, as confirmed by X-rays a few months later. It was this astonishing result that brought the medical school of the University of Münster to file a lawsuit against the parents of Dominic to revoke the custody of their child and bring Dominic back under the complete control of chemotherapy medicine. Dominic's parents ultimately prevailed, but Dominic died as a result of the terrible odyssey he had to undergo. His full story is documented online. What remains for us today to learn is that even a decade after the tragedy of Dominic, the status quo in cancer treatment is trying to make sure that no one escapes its regimen, or to be more precise, its terrible regime. Families who dare to go independent ways, many of them choosing science-based natural health and other new avenues, are being intimidated and even incarcerated. The battle for mankind to make health a human right and the right of millions of people to decide about their own body has just begun.